Well, it's fall. That means it's also flu season. Centers for Disease Control and Prevention says the past flu season was one of the longest on record, and the one before that was the deadliest in decades. Dr. Jamie Snarski from Palm Beach Gardens Medical Center joins me now for the What's Going Around segment. So we are getting into flu season. How long does it last? When does it peak?
So like you just said, flu season really didn't end last year. We saw it throughout the summer, but not a lot. So that's good. So it peaks in the winter months, so December through February, but we really don't know when we're going to see a spike, when it's going to be the worst.
Sure. Who should get the flu shot and when?
Everyone over 6 months should get the flu shot, and get it now. Get it before the end of before the end of October, actually. But if you miss October, get it after that as well.
Year to year, we hear, the vaccine is this effective or less effective compared. Tell me about the vaccine this year. Is it effective? Do we have a sense of how effective it is?
So we really won't know how effective it is until we find out which virus is going to be the big virus of the year. So the CDC makes the vaccine out of the most common 3 to 4 circulating viruses of the prior year. So it's a best guess. Hopefully they'll get it right and we'll have good protection this year.
The flu mist versus the flu shot. Which one should I consider? Is it different for various people?
So everyone over 6 months can get the shot, but not everyone can get the nasal mist spray, is what you're talking about. So that's actually only for healthy people that are 2 to 49 years old. Anybody who's pregnant or has any health conditions really can't get that, and it might not be as effective, so get the shot. I recommend
We know the vaccine is recommended. You just said get the shot. We know washing your hands is a big thing to protect yourself. What else should we do to not get the flu?
So disinfect surfaces that could be contaminated, and definitely stay away from anybody that you think is sick.
This is a question I see all the time in the mommy groups on Facebook that I belong to. How do you know if you have the flu compared to, do I just have the common cold? When do you know this is something more than just a cold that I can just sit out with rest and fluids? How do you know?
So influenza is much worse. It comes on very quickly and people feel miserable. So it's a dry cough, fever, headache, nausea, fatigue, body aches is a big thing. And really, people will feel awful, and it comes on really fast.
You have the flu. There are some different things you consider from that point forward, once the doctor tells you have the flu. So what happens next?
Stay home. Don't infect others. Don't go to school. Don't go to work. That's really hugely important to prevent the spread of influenza. But like you were saying, rest, lots of fluids, and there is treatment for it. So you can call your doctor if you think you have it right away to get in. There's Tamiflu, which is an antiviral medication, but it really only works if you take it within the first 24 to 48 hours. So it comes on quick, get into the doctor quick, and it doesn't cure you, just cuts down the duration of symptoms.
Yeah, but don't delay, like you heard, time is of the essence if you even want it as an option. Dr. Jamie Snarski, thanks for being here. Here we go with another flu season. Now